Hi, this is Brian Green, host of Healthcare IT Talks. This episode is part 2 of our series with Michael and Ryan from Dell Technologies, where we're going to talk about AI, machine learning, and predictive analytics in enterprise imaging. So Michael is a global business development leader and the chief technology officer for digital pathology at Dell. And Ryan is the chief technology officer for medical imaging at Dell Technologies. Don't forget to subscribe and sign up for any free content in the link in the description box. And thanks for joining us for this episode. Almost everybody that's come to this podcast has discussed AI to some extent, but I really haven't had a lot of good, pragmatic discussions about AI. And I'm wondering if the, from your perspective as a storage vendor, how you guys look at AI, and how we can use all this data, right? Or how we can use it for, say, predictive analytics, right? As you know, because there's these different categories of AI. Some people, when they think of AI, they're thinking about, computers being able to diagnose patients, right? I think that's the common thought. But there's so much other useful stuff we can do with this massive amount of data. I'll let you guys kind of comment on that.
No, for sure. Are we thinking about using machine learning for, increasing diagnostic confidence, or increasing clinical productivity, including increasing operational efficiency? There's all kinds of attributes how you might want to apply technology like this. And I don't think the aspiration is to, that these tools are meant to replace anyone or certainly to go out on their own. But I think there's great value in trying to use them to gain insights to advance the way we deliver care, whether that's from an operational perspective or from a diagnostic perspective. I think both are hugely valuable to helping in, speeding the time to care, increasing the quality of care, and reducing the cost. So, so we believe that. You asked the question about from a storage infrastructure vendor's view on that. So what we would say is speed always being important, and in the case of homing accuracy or improving accuracy, more data is better. What we've been trying to do at Dell is to continue to make sure that we expand our product offerings and in a way that continues to deliver performance at scale and delivers newer technologies, whether those are all flash nodes versus, spinning disk hybrid nodes, or hybrids with some SSD and some spinning disk, in which to ensure that as the demand increases are happening, so that's just more data,
right?
And the speed demands are increasing, and that, hey, we're trying to chew on more data faster, that in fact the infrastructure will not be the bottleneck.
Yeah.
Okay.
Mike just said a great thing, right? I love what he said about operational and clinical AI. That's a key factor when you talk about, everybody talks about AI. But then when you start to drill down, what are you referring to? Are you talking about both? Are you looking into how much radiation exposure does a patient have? How much time to are they in the clinic? And how much time is it taking for a diagnosis to be provided to them? That's operational. Right? Or clinically, are you trying to enhance a physician's ability to look at something or prioritize something in a work list to make sure it's seen immediately? Those types of things. And then getting to the storage piece too. AI is only going to be as good as the data access you have, right? Otherwise, what's the point? And computing that, right? So Dell is obviously a leader not only in the storage aspect of having that data, housing it, cataloging it, and making sure it's available, but also the compute side, being able to process that data, whether it be CPU driven or GPU driven or however you're going to do it. Dell has the components to make sure that whatever AI you're doing, it's going to be successful, because ultimately every AI is different, right, Brian? You probably see this in GE a lot, is that everyone is very different. I mean, you get some people that say, I want only do this and it's all GPU based and we're going to do a server side rendering and we're going to
Yeah.
then you get other people that are like, hey, I want a copy of all the data and put it over here and we're going to churn through it with CPU and drive catalogs and that. It's all kinds of things that come to it. So you want to be very flexible in your infrastructure so that when the AI vendor comes, which you're going to have probably 52 of them, they're going to come to you and you're going to be able to say, okay, yeah, we can support whatever type of technology you're leveraging to deliver the AI results. That's really the key.
Yeah, what I picked up there, Ryan, is I think you alluded to the fact that everybody's using this term AI, but it's so broad, right? Oh. It's kind of like the old days saying we're going to use computers in healthcare. Well, of course we are, but that. There's a lot of ways we can use,
right. And we may get to that point too, where the idea of AI is just ubiquitous in these kinds of systems that we're talking about, that you just assume that there's intelligence baked into them, right?
Yeah.
And then we leave all the anthropologic decisions around how they should be used and what effect it will have on how people use them to a different conversation.
So you guys were at HIMSS. How often did you see the term AI thrown around at HIMSS?
Every vendor has it.
I would say it rolls off the tongue easily for people.
Yes.
Yeah. Sure, we have AI, right? That's
everybody, right? Everybody wants to talk about it, but then when you actually ask them about it, and you truly if you really are inquisitive and you understand it, that's when I think you'll start to see a little bit of things fade. But overall, there's a strong AI presence inside of healthcare IT, inside of imaging, et cetera. I mean, there is.
Yeah.
And it continues to grow. I mean, if you think of RSNA, I remember when AI 5 years ago, there were 6 vendors, right? And now there's a whole pavilion, right, based upon AI and what we're doing in imaging and across the board. So it's getting there.
Yeah, absolutely. Going to pivot again. Talk about, in my notes, I have the topic, it's cloudy with a chance of DICOM. Because when I think, so I've been asking people about cloud. This has been an interesting topic in the area of enterprise imaging, right? Because one of the challenges with enterprise imaging, and you guys know this, is it's a massive amount of data, right? How do we leverage the cloud with such a massive amount of data that has to go to and from, the health system? And a couple ways I wanted to chat about this. One is I know that Dell previously, if I can talk about this, Dell used to be very focused on the kind of a software as a service model with cloud enterprise imaging. Dell somewhat divested from that, and I think you guys are kind of moving in a different direction, which may be kind of aligned with where you see the market going with how they, how the market is sort of starting to leverage cloud. I'll let you guys kind of comment on that, but where you feel we're heading in this with cloud.
I would say that Dell launched a company-wide program last year called Apex, and so it wasn't a pivot as much as I think it's more of an expansion. That it's continued to been brought to the market, which is looking at what some customers are asking for, that they tended to look to say, well, I need to go cloud. Why do you need to go cloud? Well, it's hard for me to forecast my future demand, and so then it's hard for me to know how to think of my total cost of ownership and my capital expenditures associated with infrastructure technology. So Dell came forward and said, well, if that's what you're interested in, we can provide you an operational model for infrastructure. We can provide a managed service for your infrastructure to help you with that. So where the advantages of on-prem is in the area of control and administration, and maybe some advantages around security, and certainly more assurances around performance are better understood by customers, that they could retain those on-prem benefits with on-prem infrastructure, but leverage some of the financial benefits that people tend to associate with cloud. Now, having said that, Dell is very pro-cloud, and we have great relationships with the hyperscalers and cloud offerings, and our own hosting offerings ourselves in which to support that. I guess I would sum it up, and then I want Ryan to talk a little bit about how we've been thinking about it specifically in medical imaging. But that we've been really looking at use cases. I think the decision in the industry has been made. It's not one or the other. It's a hybrid world.
Yeah.
And the decision of how you leverage one versus the other within your hybrid deployments is about the use case. What are you trying to accomplish, and what serves the best offering to solve that? Is it putting more for cloud for elements of compute where the compute requirements are very bursty, and I only really want this really high demand compute for shorter periods of time, so do I really want to keep that on-prem? Maybe not. Versus, hey, it's really important to me to know that I always have control and security of the data, so it may make more sense for me to keep these elements on-prem. So I think you have to look at use cases.
Yeah, and Mike, I think, and Brian, specifically, right, to enterprise imaging, there's a couple things to it. So one is we have, VirtuStream, as you may know that company, that's a Dell Technologies company. They're doing a lot in this hosted, managed service, cloud-based offerings, right, all throughout kind of the industry.
Yeah.
But with medical imaging and enterprise imaging as a whole, it becomes, what are you going to use the data for diagnostic reading, or are you going to use it for referring reading? Right, that's really where you start to drive this path wedging, right?
Yeah.
Because ultimately, what happens is you never want to impact your clinical care. You don't want to impact your clinical workflow. And a lot of times, taking data to a cloud-based offering and not having some sort of edge-based computing will change the workflow, right? Whether it be from latency perspective, whether it be from technology perspective, it changes it, right? And so you never want to do that. So obviously, when it comes to diagnostic reading, we're seeing still vast majority of our customers want on-prem, whether it be, again, a cache, an edge, something like that, and then they'll have their archive maybe in a hyperscaler or a cloud or et cetera. Yeah. We also have some unique offerings where the data does reside in an off-site data center, but we have unique piping and unique tools to actually leverage the data from the hyperscalers or leverage the tools from the hyperscalers. So instead of taking your data to the hyperscaler, we're actually bringing the tools of the hyperscalers to your data. So it's a very different model, and we're seeing that become very interesting when it comes to imaging because, as you said earlier, imaging's big, right? It's big, massive data sets, and trying to put 10 petabytes of storage up in the cloud can be a little difficult. And once that data's there, now what? Like, oh my gosh, all my data is up there. If I ever want to get it back for some reason, you're in for a long haul. And so I think that's where we see it.